Quinn, tell us about how much you are using telemedicine.
Well, actually, it's a really good experience. I'm going to admit I was a little hesitant at first, but once I started and the patients, they came on. For instance, I had a patient Friday night and he had a skin lesion. It was a red area. And I did a full exam with the telemedicine platform and was able to get him the medication he needed with a follow-up referral. I mean, it was a great experience. And I basically have been triaging patients and treating them all weekend. And so far, it's just been thumbs up all the way.
Now, the push has been for people to use telemedicine rather than coming to the office. Have you seen more people using telemedicine?
Yes, I have. And it's being highly encouraged all the way up from the CDC to the World Health Organization, even to our local governing bodies such as the Academy of Family Physicians, the Mississippi State Medical Association. And what's really, really wonderful is the fact that these entities are lobbying for us, working directly with the governor and the government of the state of Mississippi, and they've gotten specific proclamations where the insurance companies are now compensating for the telemedicine services. Before, the telemedicine in a lot of cases was not covered by insurances, but they did an emergency proclamation, and now the physicians, the medical facilities are now being compensated for the services that are being rendered.
That is wonderful news to hear, Dr. Quinn. Tell us what can be accomplished with telemedicine and what needs to be done in person exactly.
Well, basically, there are some people that are definitely a telemedicine candidate, but then there are some people that might need a little bit more. For instance, I had a couple of patients over the weekend who presented with a history that was definitely not a telemedicine. For instance, one patient, he was having chest pain. So I actually called 911 on his behalf, and he went to the emergency room. He was not a telemedicine candidate as far as a completion of therapy, but at least he was able to get the information he needed to get the emergent care that was really, really an emergency. But telemedicine is really good for triaging, and some people don't have to follow up because everything is accomplished through the telemedicine visit, but it varies from one patient to another. But the most important thing is right now, while we're in this epidemic with the coronavirus, the COVID-19, we're trying to keep people from having to go to the doctor, exposing them to the possibility of getting this infection. So what the telemedicine does is it allows us to provide treatment to the patient and let them remain in their home safe so that we can continue to, at every chance we get, to continue to practice social separating people from others, and that way we can cut down on the spread of this virus.
Absolutely. That's why telemedicine has been so helpful during this pandemic, and telemedicine really is the future of medicine. Thank you so much, Dr. Quinn.